You are muted.
Oh, sorry. Can you see my slides now?
Yes, looks great.
Perfect. Well, hi everyone. My name is Nicholas Grubic, and I'm a PhD candidate in epidemiology at the University of Toronto. And my research centers on understanding the epidemiology of cardiovascular disease, how different social and economic factors shape cardiovascular health outcomes, and how we can use specific advanced analytical techniques to study these relationships. And today I'm going to be sharing with you some findings from the first objective of my dissertation, which examined trends in income-related inequalities in cardiovascular health among three age groups. And this work was done in collaboration with my primary supervisor, Katerina Maximova, as well as Sarah Carsley, Arjun Siniki, and Christian Carmelli. So cardiovascular disease is still a major cause of death worldwide, as well as here in Canada. And even though the rates of this disease and its related deaths have been improving over time, the overall burden is rising because one, our population is aging, and two, more people are developing key risk factors such as high blood pressure, diabetes, high cholesterol, and obesity. And what's important to recognize is that these risk factors, as well as the cardiovascular outcomes that they can lead to, are not quite experienced equally across the population. So among older adults, we see very clear socioeconomic inequalities where people of lower income, less education, and lower status occupations tend to have worse cardiovascular health. However, we really know much less about whether these inequalities start earlier in life, which is especially important as cardiovascular risk is increasing among youth, and early disadvantage can often carry forward into adulthood. So to explore this, we analyze nationally representative data to assess socioeconomic inequalities in cardiovascular health among children and adolescents, young adults, as well as middle-aged adults in Canada from 2007 to 2019. So our study drew on more than 12 years of data from the Canadian Health Measures Survey, which is a repeated cross-sectional survey conducted every 2 years by Statistics Canada. Our population included over 25,000 non-pregnant respondents without existing heart disease, and we grouped these into three age categories: children and adolescents, young adults, and middle-aged adults. To measure socioeconomic position, we calculated each respondent's equivalized household income and categorized it into four quartiles. And our primary outcome was a composite measure of suboptimal cardiovascular health, which is defined as the presence of obesity, hypertension, diabetes, or dyslipidemia. And these conditions were identified using objectively collected biomarkers as well as self-reported medication use. And in our analyses, we examined both trends in the prevalence of suboptimal cardiovascular health from 2007 to 2019, and also quantified both relative and absolute income inequalities over time. So what do we find? So looking at overall trends in the prevalence of suboptimal cardiovascular health, we observed a meaningful decline in this condition among children and adolescents, which reduced from 23% in 2007 to 17.1% in 2019. However, when we look at young and middle-aged adults, the prevalence stayed fairly steady over the study period. And when we compared males versus females, we found that the temporal patterns were largely the same, although females consistently showed lower levels of suboptimal cardiovascular health across all age groups. When examining trends in income-related inequalities in cardiovascular health, we found that inequalities tended to increase over time among children and adolescents, and specifically, these increases were more pronounced in males than they were in females. In contrast, among young adults and middle-aged adults, income inequalities remained relatively stable over the study period, although there was some specific fluctuations across the survey cycles we considered. And overall, we did not observe any significant temporal trends in inequalities for either young or middle-aged adults. However, we did notice that there was divergent sex-specific patterns, with inequalities decreasing among females and increasing among males. So in summary, our study found that income inequalities in cardiovascular health remained evident across Canadians aged 6 to 64 years, with the most concerning increases occurring among children and adolescents. So moving forward, this study provides evidence that Canada really will need to consider additional prevention efforts and public health policies that are both equity-driven and also sensitive to sex-specific patterns in cardiovascular risk. Thank you, and I'm happy to take any questions.
Thank you.